topical corticosteroids, also known as topical steroids and flare control creams. These creams are the mainstay of treatment for most people to help keep your eczema under control. They can come in a variety of forms. Sometimes they may be cream base, which is not quite as greasy. Sometimes doctors may decide that an ointment base, which is a slightly greasier version, may be the most effective way of giving these creams to a patient. Sometimes they may be as a lotion, which may be a lighter base that's easier to use in areas such as your scalp. These creams are based on your body's natural hormones that are released to help counter inflammation throughout the body, including the skin. What these creams do is that they reduce inflammation in your skin, and in doing that, that allows the skin barrier to heal itself and return to normal and become more effective. And that then allows people to rely more on their moisturizers as an in-between way of keeping their skin managed. Are topical steroids safe to use on eczema? Yes. Topical steroids are derived from cortisol, which is one of your body's natural hormones. And one of the functions of that hormones is to naturally calm down inflammation. When we use it on your skin, it helps calm down the chemicals that your body's making, which are contributing to itch, pain, and discomfort. It helps to switch off the inflammatory cells that are in the area. And in doing that, it allows the skin then to heal. And when it heals, it'll go back to normal skin and help to switch off temporarily the eczema process. Are topical corticosteroids safe to use on broken skin? Yes. Most time with most people, when their eczema's, the skin's broken and inflamed, it's just because of the disease activity of the eczema and not because it's particularly infected. So the worry sometimes that patients may have, or that GPs may have, is that there's a significant infection component there and that giving cortisone creams might make that worse. But in reality, that's not the case. And the important priority is to try to heal the eczema. And if we do that, then that will get rid of the bacteria that are in the area. So it is perfectly safe, and it's not going to increase the risk of infections or complications if the skin's broken. Do topical corticosteroids cause skin thinning? The answer generally is no. Some people will read about from time to time a risk of cortisone creams thinning your skin. In reality, you would have to use very strong creams for a very prolonged period of time, often constantly for months or years, for there to be any slight risk of them thinning your skin. As long as your creams are being managed in conjunction with your doctors, then they'll be able to watch for any of those early signs of this appearing, which would be very unlikely, and to change the treatments if they thought that was appropriate. Do topical corticosteroids change skin colour? No. Topical corticosteroids don't change the colour of your skin when you're using them to treat your eczema. What often confuses people is that eczema itself can sometimes temporarily affect your colour cells to switch them on or off. When the eczema is active, the chemicals it makes sometimes will cause your colour cells to temporarily switch off. And if that's the case, then when you treat your eczema with your cortisone creams, the underlying skin, when the redness goes, looks slightly paler than what it does normally. That's not because of the creams, that's because of the eczema process itself. However, once the eczema is gone, then the skin is able to naturally tan itself back up again. For other people, when their eczema is active, it may temporarily overstimulate the colour cells in your skin, making your skin slightly darker. But again, once the eczema is treated, and the cortisone creams will be the best way to achieve that for many people, then the skin colour will gradually return itself back to normal. Will they cause topical steroid withdrawal? No. Topical steroid withdrawal is a term which people use from time to time to cover a variety of different issues. Cortisone creams themselves tend to be a very effective and safe way at managing your skin problems. Sometimes what people notice is that when they stop using their cortisone creams, not long after their skin can start to flare back up again. That's not because of any effects that the cortisone cream is having as a rebound on your eczema. That's simply because the cortisone cream was doing a great job at keeping your skin under control. And when you stop using the cream at some point down the track, because this is a chronic disease, it's not uncommon that it will start to flare again. Another rare side effect that people get from time to time is a disease process where the cortisone cream is fixing your eczema, but a secondary acne-like rash can pop up temporarily. Sometimes that does need a short break from your cortisone creams while we address that, but for most people that's a very rare phenomenon, and for most people the mainstay of your treatment is going to be to continue with your cream and not to worry about the risk of this particular issue. Will they cure my eczema? No, cortisone creams won't cure your eczema. With eczema, it's a genetic condition, and so that is a lifelong change in your skin that we are trying to manage. But what cortisone creams will do is they will help keep the inflammation and the symptoms of it under control and help bring your skin back to being as close to normal as we can at this point of time, in combination with using your moisturizer creams and your other medications that your doctor may institute to help your overall management of your eczema.